Okay, for our listeners who can't see this because they're driving a car or whatever, I'm getting my brows done.
He's getting, yep, I'm giving him a little bit of a makeover.
Next week, we're going to do Brazilians.
What is a Brazilian, babe?
It's slightly more than 1 million. I don't know. Brazilian.
Okay, so
Past the fire, past the sounds. Moonshine through the clouds. Saddle up, 'cause there's no stopping me now.
Good day and welcome to another exciting episode of this.
careful.
Oh, wow. Living well together.
Big life in a small town.
About knock that off the wall.
I know. Yes. Be
aggressive. Yeah. All right. Well, it's
now you know. Yeah. Thankfully.
Hello.
Yeah. So how was your day today?
Well above average.
Good.
Probably better than it deserved to be.
Good.
Yeah. I mean, it's February.
I know.
How could it not be good?
Yeah. All kinds of things happen in February.
For instance?
We have birthdays galore.
We do.
Valentine's Day. So
Whatever that is.
My brother is the 10th. I am the 15th. Caitlin is the 16th. And lots of other fun in between that time.
Lots of celebrating.
Yeah, lots of celebrating. And today's an extra special fun day in Crunchi land.
Because
we launched our optimized NutriBrow formula.
Are you kidding me right now?
No, I know. And guess what I did?
I don't know what.
I brought all 4 shades
Of
so
what?
we could practice on you. Will you do it?
Nope.
I think the taupe one, that would be the best one. Can I
Don't they
just
have
do
white?
one?
Don't you have a white one?
No, white wouldn't show up.
That's my point.
No, but the brows here are darker.
Oh.
So that I was trying to think which. What? So NutriBrow launched their optimized formula, and our lip colors, Everlux lipstick and Hydrogloss lip oil are both on sale for 25% off.
All right.
Yeah, so I'm super excited about that.
So I get a facial today, a makeover?
Do you want one?
Heck
I
yeah.
didn't bring all that stuff, but I did bring my NutriBrow pencils.
Okay, here we go.
Okay, so
No, we should have got some before and after pics.
well, everybody can see you. Okay, look at them now.
Uh-huh.
And now I'm just going to do this one brow, turn this way. And so the key with
Do you want me to bring them way up?
no, it doesn't matter what you do with them. Just don't move too much.
I don't know, lose an eyeball.
And so you just do short little strokes like that.
Okay, for our listeners who can't see this because they're driving a car or whatever, I'm getting my brows done.
He's getting, yep, I'm giving him a little bit of a makeover.
Next week, we're going to do Brazilians.
What is a Brazilian, babe?
It's slightly more than 1 million. I don't know. Brazilian.
Okay, so it's really interesting because I talk about the tail of the eyebrow.
Yes.
And how that usually indicates thyroid health.
Sometimes.
But we've gotten your labs back and your thyroid is good. So
Okay.
I don't know.
Good to know.
Yeah, let me see. Oh, yeah, that gives you a little bit of color there.
Now, can you make it kind of curl up on the ends so it looks like a...
No. Okay. What do you guys think? Can we leave them just one done for now?
Yeah, why not?
You're gonna forget when you leave here.
Okay, you guys, just so you know. Okay, with my silver fox here, this is the shade of taupe. And it's the perfect color for you because it matches what the hairs of your brow.
Okay.
Yeah.
There you go.
And so the importance of, I mean, it really does make a difference. I might stick this in your bathroom in case you want to use it at other times.
Can I get some of those big lashes too?
Yes. We could. Do you want? Actually, if I had my magnetic liner, I would pop some on you.
There's no way. Yep. Terry's a pretty good sport, isn't he?
You are a very good sport. Okay, you guys. So the importance of NutriBrow, shaping your brows is really important. Adding some color, it helps to frame your eyes.
If you make them really
important.
straight, it makes you look mad. If you make them like the arches at McDonald's, it gives you a different facial expression.
More circus-like.
Yeah.
But
a little Botox in there, or maybe a lift, a little tightener.
No, we don't do that.
Preparation
no Botox,
H?
No filler. That was Aunt Gwen. That's what she used. That was her classic thing for smooth skin.
It lifts and tones.
Yep. And she had some really smooth skin.
All right, sir.
She really did. But that was her secret weapon.
H?
Yep.
Are you kidding?
Nope. No, I thought you knew that. I thought that's why you said it.
Nope.
Yeah, I think Uncle Gary told me that.
I'll be darned.
Hi, Uncle Gary.
It's got alum. That's the primary thing in that, is it not? Alum? What's
Oh,
the active ingredient in preparation H?
So alum is something that shrinks hemorrhoids. So that's probably what it was.
What's in preparation H?
But so does witch hazel. Witch hazel is good for hemorrhoids too. But we are completely off topic because
We're on the other end of the spectrum.
We are going to talk about heart health today.
Okay.
Because
it's February.
It's February, and in the office, historically, February,
Heart Health
you guys
Month.
focus
I think
on that.
that's like a national thing. I don't think we
is it
invented
really?
it.
Oh,
Yeah.
okay. Well, that's nice that you guys kind of go along for the ride.
Right. Well, we might have a different take on it. We might have a slightly different perspective on it. But when you look at, well, here's a question to see if maybe everybody out front knows this. What is the leading cause of death in America? Anybody? See, I don't even have to raise my eyebrows now. They already look surprised.
They don't look surprised. Your left one looks.
My left one looks like, what is going on?
Do you want to see?
No.
Okay. Well, let's keep going.
What do you got to do to wipe it off?
Well, it's waterproof, so. But it's not
so you need
permanent.
Turpentine,
You just need soap and water.
gasoline.
No, just your charcoal facial bar.
Oh,
Yeah.
perfect.
Yeah,
Yes.
that'll
yes.
work.
Oh, you're giving away all my beauty secrets.
I know.
Charcoal facial bar. Terry,
So the leading cause of death,
do you know?
is it heart disease?
It is heart disease.
Yeah.
Actually, between
Is it heart attacks specifically?
it is
or-
cardiovascular disease.
Okay.
So that's stroke, that's heart attack,
Oh, okay.
that's
All of those
cardiac arrest. There's a handful of things that they'll call it. But at the end of the day, it really does revolve around the disease in the cardiovascular system. So myocardial infarction or any kind of compromise to cardiac tissue that shuts off oxygen is going to be a bad day for that person. So roughly 30% of all death in the United States is related to the heart or the blood vascular system.
So one of the things that I was reading, that's not an old age issue, though.
It used to be.
It used to be, but
it used to
it's
be old
changed
people had heart
dramatically.
attacks.
Yeah.
In the last 5 years, I don't know what's been different in the last 5 years.
Yeah.
But now you're seeing children, teenagers, 20 and 30 and 40-something-year-old people dropping dead with heart
healthy
disease.
people. Yeah.
No, you can't be healthy and die at the same time.
Well, outwardly,
Oh, yes,
no
they would appear
issues.
fit or healthy.
Yes.
A lot of athletes.
yes.
And I forget that
Soccer
number, but it's over
players.
1,500. Like in the last couple of years, like lots of athletes have just keeled over with heart attacks. I don't know why.
Well, we don't need to go there, but I think that the word is getting out about the why.
Yeah.
The important part of that is that continuing to look at how to remove spike proteins from your bloodstream.
Yes.
And there are
Which we're not going to probably cover today.
no, we're not going to cover that today. But at some point,
Because
we really
even
should.
before the invention of the injection, heart disease was the leading cause of death.
Right.
And cancer is number 2, but they kind of flip-flop, right? And they both take over 1 million people a year
Yeah.
here in the U.S.
Yeah, because cancer is on the rise too. Turbo
Exactly.
cancer, especially.
And so that's my point. And they kind of argue back and forth who's the leading cause of death. Because if you're the leader, you get more research dollars.
Oh.
So no.
Oh, so
we
they
kill-
want to-
Oh, we kill
Oh.
more people. No, you don't. No, we kill more
Oh
people.
my gosh, that makes me sick to my stomach.
That has to do with where
And the
funding flows.
the third cause, do you want to talk about that?
Nope. But that's our healthcare delivery system.
Okay, we don't have to talk about it, but it is,
Yeah. The third leading cause of death is actually our healthcare system.
which extrapolate on that a little bit.
Well, they used to think it was medical mistakes, but it's not.
Okay.
It's medicine done properly. Still
still
takes more lives than most other. Not car crashes, not diabetes, not other things. It is actually the healthcare delivery system in America. That is, and I would argue that technically that's number 1 because most people don't die from cancer. They will die from cancer treatment.
Treatments, yeah.
And so cardiovascular disease is the slow one, though, because you'll look healthy, you'll look fine, and the next day you're not fine. So if we go by how we feel and we go by how we look, we are very often misled or behind the curve because by the time you're having your heart attack, it's been maybe years in the making,
Right.
but it's way too late to stop it.
Yeah, exactly. And all of this data and information can be referenced on the Centers for Disease Control.
Yeah, the CDC doesn't hide stuff in that regard.
Yeah, and this isn't to stir up fear. This is to let you know that there are options to take care of your heart early, to start evaluating. You can do blood work. C-reactive protein is a good one to to
Well, there
identify.
are many good barometers for how healthy is my
Right.
heart.
Yeah.
But the thing is, we've kind of led, and we talked about this more than once. We've been
Yeah.
led to believe that how we feel is how we are,
Right.
and that if there's no apparent problem, we don't need to worry about it. But you know what? The dentists have done a way better job.
Yeah.
People know how to take care of their teeth. You don't wait until you have a toothache. Well, some people do. You don't wait until you have a toothache to go to the dentist. You go get them checked. If there are cavities that are small, it's better to fix a small cavity than it is to wait till you need the tooth pulled or
Right.
root canal or whatever.
Do we know?
I'm just saying.
How do we know
wait.
that, babe?
Sometimes you wait too long.
Well, and I think that you've done a really good job educating your chiropractic patients along that line.
If somebody, somebody has to.
Yeah.
You're not going to learn about how to manage your health on TV. TV doesn't teach you how to manage health. We did
No.
some episodes recently on the food pyramid and some other
Yes.
things that are being revealed just regarding how Americans do things. There are some people that think healthcare should be free. Well, guess what? I think managing your health should be smarter. Crisis management. We don't have a healthcare system. We have a disease care system. And it's costing us like trillions of dollars, $3.5 trillion a year
Yeah.
at the last count. So it's a lot easier to be healthy and manage health. It's much more financially responsible to manage health than it is to wait until there's a disease process that then needs to be managed. So,
Yeah.
there's...
Well, I think the thing that I'm thinking is like most people, just like when the breast cancer awareness thing came out decades ago, it's like we are aware that we need to take better care of ourselves. I think that the awareness part of it is kind of, I don't know, kind of a joke to me in a way, because it's really about providing options for people, right?
Yeah, there's nobody that's not aware of breast cancer.
Yeah.
Everybody's
or
aware.
heart disease, don't you think?
Or heart disease, right.
Yeah.
Everybody's aware of it. What everybody is not, though, is informed as far as the management
Yes.
of their well-being instead of waiting until there's a disease that needs to be
yeah.
attacked.
And knowing that there are options for that.
Yeah,
That's what I'm thinking.
You don't have to be a genius level thinker to understand what's better, apples or Oreos.
Right.
You know what I mean? So
Yeah.
part of this is we're feeding disease, and that includes cardiovascular disease. Food matters in that process. Exercise matters in that process. Walking, which is free, 30 minutes a day, 5 days a week, reduces your risk of cardiovascular disease by over 50%. If all you do is walk more,
Yeah.
move more.
Right.
So we've got this sedentary lifestyle thing going where people just, don't move much.
Order their groceries online. Me.
Well, that's not the crime of the century.
But it's the same kind of thing. Like if I left the house to go purchase groceries at the grocery store, that would be a lot of walking around.
That's where the pandemic lockdown situation,
Yeah.
everybody realized you can do a lot of things from your couch.
You can. And
you don't
we
have to
got
get
kind
up
of
and
sucked
move.
in.
But that's why they, the other thing that happened during the lockdown, though, was exercise equipment sales went through the roof.
That is true. And
People-
camper sales.
Created their home gyms. People did a lot of remodeling. People did, what do you got?
It came with me from the house. It looked like it.
Is that my next eyebrow treatment?
No, this is just crinkled paper from a gift
Okay.
that I was putting together.
Got it.
But let's talk about blood pressure because it's a signal, not necessarily a failure system. Although from experience, I have, what do they call it? Idiopathic hypertension
You know what idiopathic means?
that nobody knows why.
We don't know why.
Yeah, we don't know why.
That's
And
the
we don't
science
know
word for
why.
we don't know why.
Because I have pretty sweet looking blood work and, I do a lot of the right things. So, but it's just feedback from the nervous system, right?
Well, pressure in any vessel goes up or down based on demand. And so, but there's also other things at play. When you look at cardiovascular disease, think of a blood vessel like a garden hose. It has a certain diameter, which means it will hold a certain volume of fluid. You can pass a certain amount of fluid through this vessel. If the vessel gets smaller, but I want the same amount of volume of fluid, will the pressure in the vessel go up or down?
That way?
Yeah.
Yeah, it's going to go up.
It'll go up because the vessel is smaller. So constriction of the blood vessels for any reason means the pressure in the vessel has to go up. If the vessel relaxes and I push the same amount of fluid through it, the pressure in the vessel will go down.
Yeah.
Okay. So what happens with, and sometimes this is with aging, but it's definitely with the disease process.
Yeah.
If I push stuff, think of this like a garden hose. if I pushed a bunch of iron filings and broken glass through the garden hose, what would happen to the walls on the inside of the hose?
They get scarred up.
They get scratched. And the body's way of repairing those scratches is with cholesterol.
I know it's a healing. It's a healing
Right.
component.
So it'll go in and it'll patch these
Yeah.
these places. Now the downside to that is when there's other trash in the bloodstream,
Yeah.
it gets stuck in the patch. So now I've got a vessel that was a certain diameter, but because of the repair work and because of the other trash that's been collected, the size or the diameter of the vessel goes down.
Yeah.
Which means I want the same amount of blood to come through here because my
Right.
brain says I still need the same amount of oxygen.
Yeah.
So I am going to...
Which is 'cause it's smart.
Exactly.
Yeah.
I require the same oxygen, which means I need the same blood volume. But it's coming through a smaller vessel, which means the pressure in the vessel goes up. It has to.
It has to.
That's just fluid dynamics.
So and I would say that is a common issue for high blood pressure, hypertension situation. In my situation, I've had the carotid ultrasounds or however it is that they look at my blood vessels and they are clear.
Right.
And so and that's
But your
why they
pressure
can't
runs a
figure it
little
out.
higher than the average pressure. So you're a
Correct.
great example of the fact that there's no such thing as normal blood pressure.
Exactly. Right.
There's an average.
Right.
If we took 100 people and we measured their blood pressure,
Yeah.
the average would be 120/80.
Right.
So when the heart beats, the beat sends blood out into the vascular system, and that's the top number. That's the 120. So the pressure goes up when the heart contracts. When the heart relaxes to fill back up again, that's the 80. That's the low pressure number.
Right.
So when they're measuring blood pressure, you're looking at two things. You're looking at the number going up and the number going down, and you're three things. You're looking at the gap between those numbers. If the
Okay.
120 is the pump out expression of blood, but it only relaxes back to 100
Right.
instead of 80, that means the heart does not fill with the same volume of fluid, which means now to get the same oxygen to your brain, that heart now has to beat faster.
Okay.
Because it's not relaxing the same amount between beats. If there was a tiger chasing you, this is exactly what would be happening.
Yeah.
You would need more blood, and so your heart would beat more fast.
For my little legs to
because
run.
you're running away from a tiger. Yes, with or without those eyebrows. So when the numbers are staying high, that says the nerve system is staying on high alert.
Yeah.
So sympathetic dominance produces, by default, a vascular change that might result in high blood pressure. So if my
Right.
blood pressure is staying high, one of the first things I want to know about is what is my nerve system doing?
Yeah.
Not my cholesterol. I don't want to know about my cholesterol.
No.
I don't want to know, did I have too many eggs? I don't want to know anything.
Right.
I want to know.
Because that's really irrelevant.
It is completely irrelevant.
Yeah.
There's no connection between dietary intake of cholesterol and blood levels of cholesterol. There are also no studies that tell you blood cholesterol levels have anything to do with cardiovascular
Correct.
disease.
Yeah.
That's really important, and we'll touch on that in a minute. But
And
the
statins
nerve
don't help
system
women.
is supreme in governing that.
Yeah.
Because the brain is always going to say, I need a certain amount of oxygen.
Mm-hmm.
If I'm not getting it, I've got to either increase the fluid volume or increase the rate at which it's being pumped.
Right. Yeah.
So that might be. So if you're running to your doctor's appointment, let's say you're going into your doctor's appointment, but you got stuck in a traffic jam and
Yeah.
you're behind schedule,
Right.
and you had to run up a flight of stairs to get there, and when you got there, your stress level was a little
Yes.
bit uppish,
Yeah.
and now they're going to measure your blood pressure. What are they going to find? It
High
will
blood
be
pressure.
high.
Yeah.
And the good news for
Yeah.
you is they got a pill for that. That's all you needed was a good dose of some kind of pill.
So and because I am on medication for my blood pressure, because I don't want them to get hardened, I don't want it to create kidney issues.
Mm-hmm.
So I do
Periodically, you take a little
periodically
help.
I will take, and it's like a quarter of a tablet, but it's of anti-anxiety medicine, which
Everybody's
for
got to
me-
figure out what fits.
Exactly. And for some people, Losartan or lisinopril, or I mean, there's a
There's a
whole
million.
bunch of them.
Sure.
But those things didn't affect mine at all. It didn't.
Yeah.
It didn't help
Well,
me at all.
what we learned was you weren't suffering from a losartan shortage.
Right. Exactly.
Right?
Yeah.
This is not the thing for you. And that's why all medicine, frankly,
Yeah.
is not one size fits all.
Right.
But to lower the number artificially is to ask the brain to say, hey, take a break,
Right. Exactly.
which can be beneficial.
So, from a chiropractic perspective, though, there's actually a study out
Yeah.
about.
That was in the 90s, I think.
Was it? Let me pull up more of that information. So they were looking specifically in the hospital,
This was a hospital study
And it
conducted
was-
with a chiropractic doctor.
and it was looking at the misalignment of the atlas, which is,
First bone in the top of the neck versus the skull.
and that is exactly what you look at here.
That's what we do here.
in
So
this
the
practice.
same method that was used in that study is the method that we use in our practice here in Fairborn.
Yeah.
But the relationship between the skull and the atlas, or the first bone in the neck, and the rest of the spine below it, because the stem of the brain has to get through those spaces. The
Right.
brain stem is where blood vascular pressure
Yeah.
is largely governed.
So in the, as I was doing some research on it, so it's the autonomic nervous system function, the brainstem controls.
Yeah, you don't tell your heart when you
Yes.
beat. Your autonomic nerve system tells it when to beat.
So
But
the
that's where sympathetic dominance, parasympathetic dominance, that's where the vagus nerve comes through. So when
key
those structures are
findings-
misaligned,
yeah.
pressure at that part of the nerve system can alter the way the brain governs and regulates blood pressure.
Right. So the key findings for that were that this specific upper cervical correction, just like what you do here for your patients,
Right.
It dropped the systolic blood pressure, which that was that 120 number that you were
That's the high
talking about
number,
as,
right.
as the high number, dropped it by 14 points.
Yep.
And then the diastolic blood pressure number, that what would typically be 80 for an average person, dropped it by 8.
Right.
And that those results were comparable to first line blood pressure medications, but this was improvement seen without drugs. So
Yeah, it's never a drug shortage that creates changes in physiology.
Yeah.
Nobody's low on medicine when their physiology is misbehaving. You don't have your indigestion is not a lack of purple pills.
Right.
Your heart rate
Yes,
variability is
exactly.
not a lack of
actually,
drugs.
purple pills are one of the worst things you can take. There's bad
Well,
statins at
and
this
you
point.
and I know that.
Yeah. Mm-hmm.
But at the end of the day, the reality is we've been led as a culture or society to believe that medicine is going to cure these things. And it's not a cure, it's
Mm-hmm.
a change.
Yeah.
And sometimes the change is necessary. I won't say it's not. Sometimes the change will save your life.
Right.
However,
Right,
there's a
absolutely.
big difference between managing the interruption of ease in the system and managing the health of the system.
Yes, we are definitely not here to say get off your blood pressure medicine, don't take any medicine, but find out if there's alternatives.
question is, why is it
and
high?
Why is it high?
Is
yes,
it high
the
because
root cause.
your
root
diet
cause,
needs to
root
change?
cause.
Is it high because your nerve system needs checked? Is it high because you're in a marriage that you don't like? Or is it
Right.
high because you're in a job that you hate?
So a lot of
Nobody gets
times-
sick because they're eating bacon every day. And
Right.
nobody gets sick because they're smoking cigarettes every day. People get sick because of the combination of things that eventually adds up to
Exactly. Yes.
the interruption of ease.
And just like what you see here in the office with my clients, there's a lot of times that we're layering things. Continue on your medications, keep doing what you're doing, but let's change some of these other things. And then stay in touch with your medical doctor and see if you can alter that.
Ask your doctor if a healthier lifestyle is right for you.
Yeah. Do they say that?
No,
I don't-
they say
that-
ask your
we-
doctor if this drug's right for you. I was
Right.
being facetious.
Healthy- right.
Yes, ask your doctor if getting off your butt is right for you. So movement.
He said, get
and-
off your butt is right for you.
Yeah. In other words, you don't treat the disease, you treat the person. And you have
Right.
to find out what in
What
that
that person
person's
needs.
world is
Yeah.
creating
Yeah.
the stress that results in abnormal physiology, that results in the disease process.
Right.
But cardiovascular disease is not that tough to top. Sugar is like the iron filings we talked about going through the garden hose.
Yeah.
Sugar damages the inside of blood vessels.
It causes inflammation.
Cigarette
Yeah.
smoke or any kind of smoke damages the inside of the blood vessels.
Yeah.
And then cholesterol's job is to patch the damage. Cholesterol's not the enemy, it's the patch.
Right.
Cholesterol's necessary for brain function, heart function. Omega-3s are a big part of that. So the reality is cholesterol's never been the enemy. We've been told that it is. It's been vilified, but it's not the enemy. It's
Yeah.
necessary for so many functions in the body.
Going back to the cigarettes, it was really enlightening to me when your dad had kidney cancer.
Right?
He was a smoker, and then we come to find out that smoking is one of the leading causes of kidney cancer. And it's like, wait a minute, you understand the lungs,
Yeah.
but for the kidneys, it's like
It's
but
so
it all
funny.
goes everywhere.
This was several years back when my hair was darker, but I was, my dad was diagnosed with kidney cancer, and I popped in there, and I'm talking to his little doctor, his little medical guy who's now younger than me, a little redheaded fella. And I said, here's a weird question. What causes kidney cancer? And that look that people get on their face when they don't have an answer, but they have to give you an answer. And his face said, I don't know. But what he says, well, we're not sure. We think it's hereditary.
Oh my.
Well, now he's pointing the gun at me.
Oh, wow.
Because I got his genes. I got the old guy's genes, right? So I went home that night, and this is, when you get online, and it was probably like an AOL connection where it was
no, it was
dial-up
2012. It was 2012.
But no, that's when he left. That's not when he was diagnosed.
Sure.
At any rate,
2011.
I printed off a bunch of paperwork, put it in a nice little folder just like this one, and I brought it to that fella. And I said, hey, the next time somebody asks you that question, I want you to have a better answer than the one you gave me. I want you to feel like you know what you're talking about.
Yeah.
But what I found was, and I went to MD Anderson, I went to the Mayo Clinic, I went to, Ohio State, and guess what causes kidney cancer? Obesity, smoking, and poor diet.
And your dad hit all three.
Oh, my dad was the poster boy for kidney cancer.
Yeah.
He was easily 80 to 100 pounds overweight.
Yeah.
He smoked 2 packs a day for much of his life, most of his life, actually, by that point. He was in a job that drove him insane. He was married to a person who he may or may not have wanted to be married to for a minute most of those years. So the stress load in his system was super high. He was like the poster guy to set up for kidney disease and kidney cancer, which then metastasized to his lungs and some other different things.
Yeah.
But the reality was he didn't die from cancer.
I know.
He died from cancer treatment.
Yeah.
So lifestyle matters. That's my point.
Because
12 to
because
15%.
genetically.
Yeah,
That's what I was gonna
genetically,
say.
I have his package,
You do,
but only 12 to 15% of the
I thought it was
diseases
even
we
less than
manage
that. I thought it was like
have
8%.
any kind of a genetic root.
Yeah.
That means 85%, at minimum, 85% of the diseases we're managing are lifestyle driven. So I knew a long time ago, I can't live his lifestyle. I don't smoke 2 packs a day. I don't, carry around 80 to 100 extra pounds.
Right.
There are things that you can do to take charge of your well-being that help alleviate the genetic predisposition to anything that might be coming down the road for you. So just because mom had it or dad had it does not mean you'll have
Right.
it. It means you need to make choices that are better than the ones they made
Yes.
because your genetic predisposition may be, in fact, toward that process.
So it is interesting though, because my dad had high blood pressure as well. And I thought, well, I don't eat cold cuts and I don't smoke and I don't drink. And so why would I have high blood pressure? And yet from a genetic perspective, I actually do think I am one of those people because my lifestyle is so different than
It's
his
not that
was.
you have high blood pressure, babe. It's that you have blood pressure that's higher than the average
That's
blood
true.
pressure.
Okay, so I also wanted to point this out because back in the 1950s, blood pressure that was considered normal, this is very fascinating to me. Ideal blood pressure for adults was often closer to 110 over 70.
Okay.
But what is considered now outdated is a normal systolic is 100 plus your age.
Okay.
So like my normal blood pressure should be, if we were back in the 1950s, all things considered, should be 161 over, probably 90 or 100. So that made me feel better, as I was researching it a little bit.
And
I mean,
there are things that we've
anymore.
learned since then, right? So there's an argument to be made that,
Either way.
yes, it could go either way.
I
But
don't know that would be good. And anybody, if I was in any doctor's office with that kind of blood pressure, 161
they'd
over
call you an
100,
ambulance.
they would call me an ambulance. They'd be
But
like,
the
we're taking
reality,
you.
you're an ambulance. The reality is, though, as the vascular system ages, it becomes less elastic.
It comes, yes.
So as the body matures, what used to be a nice stretchy garden hose is more rigid.
Yeah.
But it still has
More
to
like a
have the
straw.
same volume of blood in it.
Yes.
The brain still says, I need that blood.
Yeah.
So when you push the same volume through a tube that is less stretchy, the pressure in the tube necessarily has to go upward.
Right.
Because the brain still demands it. So when you take a person in that situation and you say, no, we want that down, that needs to be 120 over 80.
Yeah.
Well, what you just did was starve the brain for oxygen.
Right.
Which means now I don't have a blood pressure issue with, that's air quotes, but what I now have is a tachycardia issue.
Yeah.
Because what I did was lower the pressure artificially and my brain said, wait a minute, I want that oxygen.
Yeah.
So now I got to pump this heart faster.
Yeah.
So now my resting pulse rate went up because I lowered the pressure in the vessels artificially. You just got to be super careful.
Oh my gosh.
That is such a slippery slope.
Such a slippery slope. And work with somebody who's willing to try different things, somebody that's more integrative. Like use medication if you need it, but add in that nutritional component.
Let's talk about that in another
Okay.
episode. Let's go to some holistic solutions maybe in our next segment.
Oh, well,
Time-wise, it's going to be smart to do that.
Okay.
So we'll include some of those things when we
Okay,
start
we're going to
talking
do a
about
part 2.
other-
Yes.
yeah.
Yeah, we'll talk about some other things. Yes, I got kind of down a rabbit hole with the blood pressure thing, but I think it's important. It's important to me because it's something that I've been regulating.
Part of that is about your
for a
mindset.
long
If
time.
you were freaked out about your numbers, your system would just stay on high alert and your numbers would never, ever go down. 'cause
That's
you're
why
stuck
I
on high
don't.
alert.
Yeah, I don't check it all the time.
Sure.
Yeah.
But it's just important to say that's an average number.
Mm-hmm.
And so the reality is there's no such thing as the average person,
Exactly.
right?
And
So what's good for
yeah.
you may not be good for the next person. And we've talked about that in previous episodes as well. So not all people are, no two people are created equally.
Exactly. Your blood chemistry
We're
is
equal in the
different.
eyes of the
Yeah.
Lord, but we
Yeah.
are not equal physiologically.
Right. Yes, exactly.
And so the reality is we need to manage our health individually with some guardrails. There need to be some guidelines and boundaries. And let's introduce maybe in our next segment some more of those healthy lifestyle things.
Yeah, that's a good idea. And so that'll be next week. We'll drop that.
Cool.
But yeah, the research is still evolving, and we'll, as far as blood pressure or heart health or any of those things.
And when we meet again, I'll have eyebrows that match. How about that? What do you want our listeners to do? Let's say they like
It
it.
is funny. At the beginning of this, every time I'd look at you, I was kind of like almost wanting to laugh. Actually,
You
what I
did
need
it.
to do is just do the other one because it looks really good.
All right. By the next time we do a segment, maybe I'll have eyebrows that match. How about that? They'll
Sounds
either
good.
both be white
right.
or they'll both be not. I don't know.
So yes, like, subscribe, follow, and comment. And thank you guys for tuning in. We'll see you next week. Bye.
Bye, ya.